Okay, this next test is the Thomas test. We're going to show you the Thomas test, which is going to be more specific to finding tight structures, more specific to the iliopsoas and possibly rectus femoris. So we're going to ask the patient to take his right leg, bring it up. I bring it up passively, and he holds it into as far as he can with flexion. The opposite leg is going to be straight. As you're noticing, he's having a hard time lowering his leg. He's having a hard time getting it to the ground. I also will palpate underneath the spine. Sometimes I can feel the lumbar actually move and go into a concavity as he's trying to get this position. So if the patient has a tight iliopsoas, the leg that's straight will be affected because he won't be able to completely rest his thigh down onto the table. This could be conducive of rectus femoris or iliopsoas. Next, we're going to go to the modified Thomas test, which kind of gets things a little bit more detail. I'm going to bring the patient down to the edge of the table with modified Thomas test. His ischial tuberosity is literally going to be on the edge of the table. I'm going to bring the table up to a height so that the patient's foot is not touching the table. I'm going to have the patient come back into supine, bring both legs up. From this position, I'm going to ask him to drop this leg off the table. What I should see is this leg, which you got to be careful with the modified Thomas test, is that it doesn't abduct out. I'm going to try to keep him in alignment, so his hip and his knee and his ankle are staying in alignment. And what we're seeing at this point, there's two things we're looking at. Is the leg staying parallel with the table? That will clarify iliopsoas. Is the knee going more into extension, having a hard time to get into flexion? If it's extending more, you have tightness of rectus femoris. I'll compare both sides. I'll bring his leg back up here, and we'll lower the opposite leg. And this is also a very passive test. And as we can see, he's got a little bit of tightness. He's having a little difficulty at the iliopsoas on this side. And as I try to bring him down a little bit, you can see that his leg wants to go a little bit more into extension. So this patient also has tight rectus femoris. If it's real tight, you'll see more of an extended knee. It will not be able to flex. And if it's a positive, you'll see that the leg will not be able to drop completely parallel with the surface that the patient's laying on. Modified Thomas test.